Hi, everyone. My name is Katie Ploss, and I'm joined today by my colleague, Dorrean Riley, to learn a little bit about him as he is joining our practice. Thanks for being here today with me, Dorrean.
No problem. Thanks for having me.
Dorrean is a master's level psychologist who studied at the Michigan School of Psychology. He's worked in the field of mental health and direct care for 4 years, and he specializes in working with teens and also in residential crisis facilities. So I'm going to ask Dorrean a few questions to allow us to get to know him a little bit. What treatment modalities do you offer to your clients? That is, what are your therapeutic approaches?
Okay. So, as far as my modalities are concerned, I do a lot of cognitive behavioral therapy work in conjunction with humanistic principles of talk therapy. I've also had training in PCIT, which is the parent-child interaction therapy. So, working with that relationship with parents and helping those children to understand different boundaries and things like that. I do a lot of mindfulness, existential work, and of course, psychological first aid. So anyone who's had immediate trauma and they need immediate psychological assistance, I've been able to do some certification in that as well.
Awesome. I think that's really important, especially that emergency psychological aid. What is the number one thing you find most unique about your style of practice as compared to other psychologists?
I think the most unique part of my particular style, it involves a lot of different weaving of intersectional techniques. So I combine a lot of CBT with humanistic, which is not something that a lot of clinicians do. You typically stick to one, maybe two styles, but humanistic principles are definitely important when it comes to therapy because it allows the individual to understand that the power to resolve, different mental illnesses is essentially relies with you. And so it is my job as a therapist to help guide you. But ultimately, all the work is being done interpersonally.
Fantastic. What is your most common referrals that you typically treat for?
So most common referral, children and adolescents ages 8 to 18. A lot of the things I deal with children and adolescents would be operational defiance disorder, anxiety, depression, anyone who has had suicidal attempts or ideations, and of course, gender identity disorder at that age. I also work with adults 19 to 65. A lot of the same things, anxiety, depression. I've worked with individuals with schizophrenia and schizoaffective disorder. Definitely any adjustment disorders, and I'm also working with the adult population of gender identity in that age range as well.
Fantastic. Sounds like you have a wide range of areas that you specialized in and have worked with clients.
Yes.
What is the most important thing to you working with clients?
So the most important thing is that I think therapy is it's an alliance essentially. So it's the job of you and I to work together to get you to a point where you're meeting all of your goals. It's not up to me to tell you what to do. It's up to you to come up with your goals, and let's see what we can do to do it to complete it together. Essentially, I think that's the most important thing with any therapeutic relationship. On top of the essentially getting you to a point where you are able to function in your daily life if you're having any psychosis or anything like that. So those are, I would say, the two most important things that I take a look at and that I work on.
Fantastic. Can you share a bit about your style of building relationships with new clients? Like, what could a new client expect in the first few sessions with you?
So in the first few sessions, of course, we're going to do a lot of intake, just getting to know you work, essentially, learning about yourself, your family, a little bit about your history, things that you're struggling with. And then after all of that is out of the way, then it's all about rapport building. So I'm going to work with you to, make it so that we have a trusting relationship so that you know that I'm truly here to work with you, when that we can do anything, you can talk to me about anything, and essentially let's work on getting you to a point where you would like to be.
That's amazing. Thank you for sharing. Thanks for being here with us today, Dorrean. If you're interested in working with Dorrean on your treatment goals, head over to galvingrowthgroup.com and head over to our contact tab where you can select Dorrean as the therapist that you'd like to work with. Send us your email, your phone number, and a short message, and we'll get back to you within 24 to 48 hours. Thanks so much again, Dorrean.
Thank you.